Hello, I'm Dr. Michael Chez. I'm a pediatric epileptologist in the Sacramento, California region. I am a clinical professor at California North State Medical School, and I'm also regional director of pediatric epilepsy in the Sutter Sacramento Valley region. I'm here today to talk to you about Lennox-Gastaut Syndrome and a new medication called Fenfluramine for that condition. In addition, we will be lucky enough to hear from a patient family that I take care of, the Bushey family, who will share their experience being treated with this medication for Lennox-Gastaut syndrome today. I have in the past been a speaker or have some disclosures from grants I've received from various pharma companies, and I just want to disclose that there should be no conflict today with any of those issues on these topics. So Lennox-Gastaut syndrome affects around 50,000 people roughly in the United States. It is a electroclinical syndrome that is defined by seizure type as well as EEG patterns and age of onset, typically between age 2 and 4 years of age. And there can even be later onset in some cases, even into adolescence or rarely into adult age. The main thing, it's a clinical syndrome, which is not just one cause, but multiple causes. And approximately 60% may have some type of trigger like a brain injury, infection, or brain malformation as a cause. And the rest comprise genetic and what we call unknown or idiopathic cases. The condition is associated usually with a progressive change in seizures that are refractive to pharmacotherapy or medical treatment, and that there is often a cognitive decline as well, with intellectual disability being quite high in this group, and there can be behavioral and social problems and language delays which may overlap autistic syndrome. This may occur in approximately 80% of the patients having a cognitive or behavioral comorbidity. Seizures also change from early childhood, where there's a typical classic presentation with atypical absence seizures and drop attacks, to older children often having tonic seizures only, where they stiffen up, or tonic-clonic seizures. And they can also have focal seizures as well. So there can be multiple seizure types in this condition. This is a refractive epilepsy, and often seizures of this type can lead to falls, which can lead to injury, such as concussions, loss of teeth, fractures of the face or extremities. Reducing seizure frequency is a goal to have improved safety of the patients as well as improved outcome of their cognitive and other disabilities. And then quality of life, not having to worry about having a seizure for the patient or the family, is very important. And what we would like to see is patients having as many seizure-free days as possible. Sometimes these seizures can be quite frequent, and in studies that have been done in Lennox-Gastaut, often patients will have as many as 100 to 1,000 seizures a week. And this can lead to patients obviously having very frequent problems with falling or being unsteady, often requiring wheelchairs to help them get from place to place. And these are patients who often wear helmets to protect them, along with facial masks to prevent falls or injuries. Currently, there's no one medicine or cure for Lennox-Gastaut. There are many medications that are used to try and treat the different types of seizures. And because there are different types of seizures, you might need more than one type of medicine. Some medicines work better for absence seizures and tonic falling seizures, and some medicines work better for focal seizures, and some medicines work better for grand mal seizures in different patients. There's also ketogenic diet and medical devices such as the vagal nerve stimulator, or surgery such as epilepsy surgery, including something called a corpus callosotomy, which is sometimes used as an older treatment that's still used for drop attacks. Basically, we want to have the least side effects as possible. The typical medicines that have improved in studies by the FDA in the United States include clobazam, topiramate, lamotrigine, felbamate, Epidiolex, which is cannabidiol, and it also has clonazepam was approved for drop attacks in one study, and now fenfluramine becomes the latest medicine approved for Lennox-Gastaut convulsive and drop attack seizures. The exact mechanisms of how these meds typically work traditionally have included ion channels. There's something called GABA, or gamma aminobutyric acid, which is a inhibitory chemical in our brains, which allows us to block excitation. There's also glutamate receptors, which cause excitation, and then there's modulation of release of certain chemicals. What fenfluramine does is it targets the serotonergic system, which is different than the other drugs, which usually work on different chemicals, including sodium channels, as I mentioned, GABA, or receptors for glutamate. And these are looking at something called a 5-HT receptor, particularly the 5-HT2B receptor, but it also works on other serotonin receptors in the brain. And it also works on a NMDA receptor, which targets glutamate, called the sigma-1 receptor. And we don't know if that's the only way it works. And like most anti-seizure medications, it is animal models and preclinical research lab studies in tissue of the brain that gives us what we think is the mechanism of action. But there may be other ways these drugs work that we're not sure of. So we always say we're not sure of the exact mechanisms, but these are the theoretical best mechanisms of how these may inhibit seizures. Now, what do we know about fenfluramine in Lennox-Gastaut syndrome, which is the newest drug? It was invented in the 1960s, so it's not a new drug. We do know most of the side effects, and they're not really alarming. They've been studied in psychiatric conditions and other conditions, including being used in weight loss, and has been looked at for autism and attention deficit and other psychiatric conditions. The main thing is it works on the serotonin 5-HTB2B receptor, and basically the concern of any of this drug is that it might have a cross reaction with 5-HT2B receptors that are on valves in our hearts. Now, there's a much more higher concentration in the brain than in the hearts, and at different dosages, they're affected differently. So low-dose fenfluramine is less likely to affect the heart valve stimulation. However, there have been no cases of any actual heart valvular disease in patients with epilepsy in Europe, where it was available in Belgium for over 25 years as the only place in the world since the 1990s that had it, as well as use in France, and also since coming to the United States for clinical trials, in Europe for clinical trials. There have been over 1,500 cases of echocardiograms looking for valvular heart disease prospectively as the studies started to when they finished, and there have been no cases to date. Since the drug has been released as an FDA-approved product and patients have been treated, there have been no reported cases of valvular heart disease. That has been the major concern of the FDA and doctors, to make sure patients are safe on this drug, and it looks very safe for epilepsy and the doses being used. There's mild appetite suppression. There can be dizziness and fatigue because most of these patients are on multiple medications. There's minimal drug interactions with the most commonly used drugs for Lennox-Gastaut syndrome, which include clobazam, valproic acid, CBD or cannabidiol, and other commonly used medications, because the drug-drug interactions are minimal. Patients with this drug are usually added to a regimen that includes 3 to 4 baseline medications. Most people with Lennox-Gastaut are refractive to typical treatments, and the typical patient is on at least 3 treatments, and sometimes they may have had a surgical intervention like vagal nerve stimulation being placed. Now people are doing something called responsive nerve stimulation, or neural pace being placed in the brain itself in rare cases, and also previously there were corpus callosotomies done for drop attacks. Many people are on the ketogenic diet, and this drug is compatible with that as well, as it's a low carbohydrate liquid. The patient programs do have a registry called a REMS program, REMS, and that is something where you register with the drug manufacturer for a central hub, and the government will track cases of echocardiograms to make sure no heart damage is done. And those are done at baseline and every 6 months during treatment. It's a very painless process, and almost anywhere in the country an echocardiogram can be done. And I can tell you that it's very easy to do, and it's never been a problem for patients who want to treat Lennox-Gastaut with this medication to get these tests done easily and in any age child despite their disabilities. So what is the effectiveness of this drug, and what are the doses, and how does it work? Basically, the drug fenfluramine is used at dosages of 0.7 milligrams per kilogram per day But if you're a larger patient, say above 30 kilograms or 60 pounds roughly to 70 pounds, you're going to be getting a maximum of 26 milligrams. Patients have also been studied in Dravet syndrome, which has some resemblance of similar EEG and seizure types to Lennox-Gastaut, but it has a specific genetic mechanism. Lennox-Gastaut is different diseases caused by different types of injury to the brain or genetic risk to the brain, which causes the seizures to evolve. Therefore, as opposed to a mechanism that's one type of disease in Dravet syndrome, this is multiple types of mechanisms that could cause Lennox-Gastaut syndrome, and therefore we would expect the drug to have different effect in different types of mechanisms. Although we're still figuring out where it works best, it seems overall that it does help quite a bit with Lennox-Gastaut syndrome compared to placebo. In the studies that led to FDA approval, there was an average of 194 seizures of drop attack or convulsive type a month, and then the maximum was almost 3,000 seizures a month in one patient. This was quite a refractive group that had approximately 4 seizures medicines on the study, and they added the fenfluramine to that versus placebo. They also failed an average of 7 medications in the past, and several had vagal nerve stimulator or corpus callosotomy or were on the ketogenic diet. So the average patient failed 7 medications. So it tells you this is a very tough population to treat. They were somewhat older. Their average age was 14, and there were adults studied as well as children, with a certain percentage of patients, approximately 20% being above age 18. And when they led to this study, what they saw was in different seizure types, there was a different response with an overall reduction of 26% compared to placebo being only 8% seizures over the month that they were studied. And this trial went on for approximately 3 months. The patients had a decrease of 45% in generalized tonic-clonic seizures, however, and if you had secondary generalized tonic seizures, 66% reduced. Now, there were smaller numbers of patients in the study who had those types, but the percentage of responders was higher than the 26% overall. Drop attacks were reduced an average of 30 to 34% for tonic or atonic seizures, and patients who had both types were reduced about 46%. So overall, somewhere around 26 to 40 some percent for the reduction in various subtypes of seizures, and convulsive seizures were about 40 to 60% reduced if they led to tonic-clonic seizures, which we typically think of as the seizures you see in emergency shows or TV shows showing people with convulsions. But the drop attack seizures were reduced, and overall the reduction with all numbers was about 26%. The other nice thing about fenfluramine that has been studied in both Dravet syndrome and Lennox-Gastaut syndrome is that I made a slide that basically shows that over 15 months, there was actually a maintenance of seizure reduction, even increasing over time, which led to approximately a 30 to 50% reduction over 3 to 15 months. And it suggests that the drug, once it works, doesn't wear off. You don't get used to it, and it doesn't tend to wear off, which is nice. The other thing that's interesting is we're starting to measure things called seizure-free days in some of our drug studies. And when they did the FDA trials, 50% of the patients went more than 7 days without a seizure. And, if the average patient had 149 seizures a month, that's about 3 to 5 seizures a day. To go seizure-free for 7 days in half the patients is pretty impressive. And 1 in 4 patients went greater than 17 days without seizures of the drop seizures, which is where they wear the helmets and where they're most likely to get hurt. So needless to say, it's common sense that as a doctor and as a parent, when we see that kind of seizure-free days, there's less risk of injury, which improves the quality of life for the families, not having to worry about the patients falling as often, hopefully. And as a doctor, it makes me feel that we've provided some improvement in safety for those patients. So in conclusion, fenfluramine and Lennox-Gastaut syndrome remains a heterogeneous or mixed condition with multiple causes and refractory seizures that are often resistant to typical anti-seizure medication. Fenfluramine is a new addition of FDA-approved medication that may be effective in convulsive and drop seizures, including atonic and tonic seizures. And it's easy to add into medicines they may be on already because there's minimal effect of fenfluramine on those medications. And it's not shown any of the theoretical risk to the cardiac system, the cardiac heart valves or pulmonary hypertension risk from the 5-HT2B receptors don't seem to be evident in over 1,500 studied cases in the research trials. And so far in post-marketing, after the drug was approved, there have been no cases. And greater than 25 years of experience in epileptic patients in Belgium and France, there have been no reported major heart conditions from this medication. So I'll conclude by saying I'm excited as a physician who takes care of epileptic patients to have another tool in my toolbox, and I hope that this leaves you with a better understanding of this medication, how it is a nice addition to our toolbox for seizure control, and what Lennox-Gastaut Syndrome is and how it affects people in a clinical fashion, and how we're fighting to make quality of life and seizure control better. Thank you for listening today.
Hi, my name is Heather Bushey from Gardnerville, Nevada. My son Nathan was diagnosed with Lennox-Gastaut Syndrome, or LGS, at the age of 6. We would like to thank Cure Epilepsy and Nathan's epileptologist, Dr. Chez, for giving us the opportunity to take part in today's treatment talk. Nathan had his first seizure at the age of 4, although I'm very suspicious that he was having seizures for a long period before that. We only discovered his first documented seizure because we were visiting family, and he happened to be sleeping in the same room as his cousin. His cousin thought that he was making weird noises in his sleep and went and got his mom for help. My sister called 911, and he was taken in the ambulance to the hospital. He actually had a second seizure while on the way to the hospital in the ambulance, and because of that, he was immediately admitted for a neurology consult and an EEG. His initial EEG and diagnosis from that neurologist was actually of benign Rolandic epilepsy. We were told, like many families, that Nathan would grow out of his seizures and that likely he would have no more seizures once he was placed on medication. Unfortunately for us, that's not what happened. Immediately on returning home, he had a second seizure actually on the school bus on his way to school. And that kind of started our journey of very uncontrolled seizures. We went through what my husband and I like to call the medication roulette, where you're started on multiple medications. And we had a neurologist that it felt like we were moving not necessarily down, targeting the EEG or the disease process, but more starting with the medication that had the least amount of side effects and then moving to the most amount of side effects. So we didn't have very much success initially, and that caused us to seek out Dr. Chez. Because of the challenges that we had had previously with being in drug trials with Dr. Chez, just challenges, we actually decided to wait until fenfluramine was FDA approved to start Nathan on it. LGS has impacted our family pretty significantly. Actually, my daughter's birth was surrounded by Nathan actually having his very first seizure. She had just been born, and we were visiting family with our newborn baby when he had his very first seizure. So from the very start of her life, it seems that much of her life has been focused around Nathan's seizures, and she struggles pretty significantly with it. It's not uncommon for families when they have a special needs child or a very medically complex child for everyone in the family to somewhat revolve around that child and their needs. And then actually Nathan's epilepsy, we've discovered, we don't know what gene, but Dr. Chez is very confident that it is caused by something genetic. And my daughter actually started having seizures in 2019. So she was at age 6 when she had her first seizure. And she ended up having to be admitted and go through a lot of the same things as Nathan. Thankfully, she actually did go the path that we were told initially with Nathan, where she's going to outgrow it. She doesn't need to be on medication. And we had that resource of Dr. Chez immediately when she had her first seizure. So we were able to actually get her off her seizure medications, and she has not had any since. We've struggled significantly gaining control of Nathan's seizures, and as is typical of patients that have Lennox-Gastaut syndrome, he has multiple different types of seizure. He has atonic or drop attacks. We actually gained control of his drop attacks that occurred during the daytime with another medication. But what we've struggled controlling the most is actually his big seizures, the tonic-clonic or grand mal type seizures. And he always has those at night, typically associated with when he's falling asleep or when he's waking up is when we'll see his seizures. And we've struggled gaining control of those seizures at all. And those, unfortunately, are the most harmful seizures and can cause the most damage. So we've tried multiple different medications, titrated them up and down, switched medications to try and get control of those evening seizures, and really have not until we started the fenfluramine. So Nathan was having seizures. He would typically cluster. So he would not have a seizure necessarily every night, but if he would have one, he'd have 3 or 4, and then he'd have like multiple days in a row of having seizures. And we probably averaged 3 to 4 a week before starting fenfluramine. And after starting the fenfluramine, we are down to where we will not uncommonly go 2 or 3 weeks without having a seizure at all. And then initially, when we started the fenfluramine, which we've found when we've started other medications, we've gone through this period that is referred to as the honeymoon phase, where you start a new medication and you think that it's going to be a godsend because they just stop having seizures and it's so wonderful. And then that period will last for 2 or 3 months, and then you'll get right back to where you were at square one with the seizures. And with fenfluramine, the biggest difference that we've had is that we got past that honeymoon stage, and we continued to see the seizure control with him only having a seizure once every about 2 to 3 weeks, which is a pretty significant reduction for us. And with that reduction in seizures, probably the most significant impact, I've actually struggled because he's on a lot of different medications, and I've struggled with wanting to add medications, and cognitively he's been super delayed. And as a mother, you felt like, well, is it because I have him on all these neuroactive medications, and is it the medications? Is it the seizures? And Dr. Chez has been pretty steadfast in the fact that we need to get control of the seizures 100%, that so much of his issues are from the seizures. He was just very confident. So I've deferred definitely to the professional with that. Dr. Chez is way smarter than me. So with the fenfluramine, the interesting thing is we've gained some control of those seizures, and we've seen cognitive improvements where he's made progress in school. We've made progress with his behaviors. He's got a lot more impulse control and self-control. He's less irritable. And then interestingly, one of the other things that we've struggled with these seizures and it affecting his sleep cycles is he would start to fall asleep and have a seizure and then wake up, and he would be up for a good part of the night. So we would all struggle with sleep just because we were worried he was having a seizure, or we were worried, that he's up roaming the house after a seizure. And since the seizures have been controlled, he's actually sleeping at night as well. So beyond the seizure control, it has affected our life pretty significantly, that everybody's sleeping and he's sleeping and he's not up wandering the house and he's not having seizures, and we're not having to stay up at night worrying about the seizures. And then again, the cognitive improvements that he's had, as well as the behavioral improvements that he's had.